morning. This is Dr. Kaminsky, and today I'm here with Dr. Sean Duffy. Good morning, Dr. Duffy. How are you doing?
Great. Good to see you, Dr. Kaminsky.
Good to see you. So you've been a strong proponent of vaccines throughout this pandemic, and we've had some challenges reaching that 70% vaccination rate, and we've been presenting a lot of data about the effect of being unvaccinated with your risk of severe illness, hospitalization, and death. And we're still seeing a lot of people who are hesitant. So what kind of messages, if you saw this patient in your office, how would you approach that patient, and what messages would you like to convey?
Well, there's not one size fits all because resistance to vaccination comes in a lot of different forms. And so when I'm talking to people, I'm trying to get like, well, what is it? What's the reason they don't want to get the vaccine? And trying to dispel some disinformation that they might have.
And so the misinformation is one of the issues, and then another issue might be just a personal philosophy. How do you approach that?
Many people have some vaccine hesitancy because the vaccine is new, and so one of the first things I do is I tell people that that's a normal reaction. This is new. It's kind of scary. The vaccine is it's new. It's a little bit scary, and so is the disease. And so the way I approach that is that, well, people have been getting this vaccine now for a year and a half, and it really has been demonstrated to be both safe and effective.
Mm-hmm. Yeah, I mean the Johnson & Johnson vaccine has quote unquote older technology. It uses a adenovirus as the carrier for those spike protein antigens, and Dr. Yauhiainen has mentioned some and written articles in the UB about the fact that this vaccine is new, and yet the technology has been around and actually utilized for 10, 15 years.
Yeah. So one of the things I do is review basically how the vaccine works. I mean, like often people have concerns about this mRNA. What is this mRNA? And RNA, when it is injected with either the Moderna or Pfizer, it's a very evanescent particle. It doesn't last very long, and in that brief period, that mRNA codes for the spike protein that the virus uses to attach itself to your cells, and you create an antibody to that, and that antibody gives you terrific protection from the risk of death and hospitalization from the virus.
Mm-hmm. And some people are having these breakthrough cases where they're fully vaccinated and yet they still get the disease. And that, for some people, they're thinking, why should I get vaccinated if I'm just going to go ahead and get the disease anyhow?
Yeah.
What do you say to those people?
Well, I tell them that roughly 95% of people who are either dying from COVID or who have been vaccinated are unvaccinated, and so it doesn't provide 100% protection, but it's a very significant protection. And the number of currently the number of people dying every day of COVID is 2,000 in the United States, and that number would be a tenth of that if people were vaccinated. And it's overwhelming our hospitals at the moment, and people with elective procedures and other emergency health conditions can't get timely care.
Mm-hmm. I did a talk last Friday, and we think about the vaccines for preventing severe illness, hospitalization, and death. But the state also showed that if you're between 12 and 34 years of age, if you're unvaccinated, you're 6 times more likely to get COVID. So it does protect you from getting COVID. If you're 35 to 64, there was a 5-time reduction in getting COVID if you were vaccinated, and 4 times more protective if you're over 65. So we don't talk a whole lot about the fact that it is protective against getting infected. But we certainly know it protects you from serious illness, hospitalization, and death, but nothing's perfect. No vaccine is perfect.
Yeah, that's a very good point. I mean, with these breakthrough cases, they are so disturbing. But like you say, but the point that you make is well taken. That it is preventing people from both getting it, and then if they don't get it, then they're not a vector to transmit it to their grandparent or their father or mother, or other vulnerable people in the community.
Hmm. Another kind of concept I've kind of looked at and starting to verbalize is learning to live with COVID, because this is a marathon. We're
Yeah.
going to see we're going to see waves, and this could go on for 2-3 years, and it depends on what variants emerge. So learning to live with COVID. We there's certainly the vaccine has probably the pivotal role in the whole scenario, but also just masking and social distancing. And I know people are really itching to get out. A lot of them have been isolated for a long time. What kind of advice are you giving to patients how to live with COVID?
Get the vaccine. You know, if you're not vaccinated, you're gonna get the vaccine. It is so contagious, and it's just a matter of time. And it is something. It's not gonna go. You're absolutely right. It's not gonna go away, and it's certainly possible over time that it may become attenuated and not as severe, but it also could become more deadly to different populations. That's definitely a possibility. And we have the potential with vaccine to keep the numbers of people infected very low. And so I think that we have an obligation to our community and other people, especially vulnerable people, to do what we can to reduce the spread of the infection. And masking is a part of that, and especially when the rates are very high. So, this summer it was possible to reduce the restrictions, and people were able to go to restaurants and bars again. But with the increase in infections, the least that we can do is, if we're going to go in the grocery store, is to wear a mask, because it's one thing if we go to a restaurant or bar, we have to take the mask off. But if we're in a store or a grocery store, there's no reason not to wear a mask. It's such a simple thing to do, that can potentially, you may save somebody's life by wearing a mask.
Hmm.
That's pretty. I mean, wow, what a powerful thing. Put a mask
Hmm.
on.
Yeah, we've had presentations talking about the reproductive number of um, the coronavirus, and the Delta variant is so much more infective, so its reproductive number is higher. And wearing the mask and the social distancing effectively decreases that reproduction number, and that's
Right.
why, and that slows the spread of the cases, and
Yeah.
fewer cases, fewer hospitalizations, fewer people in the ICU, and fewer deaths. So
Yeah.
it all ties in.
I think that it is. There's a really interesting thing too that I was not aware of, is and I don't know if this is with other viruses, but it's very clear that it is true with COVID, that the quantity of virus that you are exposed to has an effect on the severity of the disease. And so that's one of the things that people are like, well, how can wearing a stupid mask help reduce the risk of the infection, or the severity of the disease? But studies have shown that it does. And if you do get COVID, but you were wearing a mask, and the person you were with was wearing a mask, who had COVID and didn't know it, uh, you may have saved their life because they didn't get exposed to this whopping dose. And that's probably
Mm-hmm.
why in New York City, when there was inadequate PPE, that these very young doctors and nurses got sick and died, because they were exposed to this large dose of virus.
Mm-hmm. Kind of like taking a shot of whiskey versus drinking a whole bottle. You're going to have much more of a
Exactly.
profound effect if you drink the bottle. So
Yeah.
yeah. Well, thank you for your support, and we'll just keep going because it's an
Okay.
important mission, and our community is important. So we'll just keep
Yeah.
going.
Okay. Thanks.
Thank you so much.
Thanks, Jake. Bye bye.
Appreciate it. Take care. Enjoy your day.